You had no chest pain, no shortness of breath, no warning. You felt completely fine, and then your heart stopped. This is the most common story in cardiology. The number one cause of death in men under 50 is not cancer. It is not an accident. It is a heart attack that nobody saw coming. The terrifying truth about heart disease is not that it is deadly. It is that it is invisible. For years, sometimes decades, building silently inside a body that feels completely normal, goes to the gym, gets good checkups, eats well, and then one Tuesday morning it stops. Today we are going inside that silence. We are going to show you exactly how a heart attack builds when everything seems fine, and the specific signals your body is already sending that almost nobody knows how to read. Let us start with the most dangerous sentence in medicine. I feel fine. Heart disease specifically evolved to let you feel fine, right up until the moment it does not matter anymore. Here is the number that should change how you think about your body forever. 50% of first heart attacks have no preceding symptoms. Not mild symptoms, no symptoms at all. The first sign of heart disease in half of all cases is the heart attack itself. Think about what that means. The system designed to warn you failed completely, not because your body was broken, but because nobody taught it the right questions to ask. Atherosclerosis takes 10 to 20 years to develop, 2 decades of silent construction inside the walls of your blood vessels. No pain, no signal, no warning light on the dashboard. Think of it like a fire burning inside the walls of your house. From the outside, everything looks normal. The paint is fresh, the lawn is cut, but inside the walls the fire has been burning for 15 years. And your annual checkup? That is someone walking around the outside of the house and saying, "Looks good to me." Standard blood panels do not measure arterial inflammation. They do not measure plaque stability. They measure proxies. Useful proxies, but proxies nonetheless, and a proxy is not the same as looking inside the wall. For decades, medicine told you the same story. Lower your cholesterol, eat less fat, and your heart will be fine. That story was dangerously incomplete, because here is what the research actually shows. Half of all people who have heart attacks have normal cholesterol levels. Normal, not borderline, not slightly elevated, normal. So what is actually killing them? Inflammation. Chronic low-grade inflammation inside the arterial wall. Most people imagine a clogged pipe, cholesterol slowly building up until nothing can get through. That image is wrong. The real mechanism is more like a volcano. Plaque builds up inside the arterial wall, not inside the channel. The artery compensates by expanding outward, so blood flow looks normal on a scan, until the plaque becomes unstable. Inflammation destabilizes the plaque. The cap ruptures. A blood clot forms instantly at the rupture site. The clot blocks the artery completely. That is your heart attack, not a slow clog, a sudden explosion. The trigger is not the size of the plaque. It is the instability caused by inflammation. A small, inflamed, unstable plaque will kill you faster than a large, stable one. The question is not how much plaque you have. The question is how inflamed and unstable that plaque is, and standard cholesterol panels do not answer that question. Your body has been sending signals for years. The problem is nobody told you what to listen for. Here are 4 signals that appear years before a heart attack. Signal 1, a white ring around your eye. Look in the mirror at the outer edge of your iris. A thin white or gray arc running along the edge of the cornea. It is called arcus senilis. In people under 50, it is not cosmetic. A study in the British Medical Journal followed over 12,000 adults for a decade. Men under 50 with arcus senilis had significantly elevated risk of ischemic heart disease. The same lipids depositing at the edge of your cornea are depositing inside your arterial walls. Visible, free, requiring nothing but a mirror and 30 seconds. If you see that ring and you are under 50, that is a conversation you need to have with your cardiologist this week. Signal 2, sleep apnea. Obstructive sleep apnea causes repeated oxygen drops throughout the night. Each drop triggers a stress response. Cortisol spikes, blood pressure spikes, inflammation rises every single night. If your partner tells you that you stop breathing at night, that is not an inconvenience. That is a cardiology appointment you have been postponing. Signal 3. Blood pressure difference between arms. Take your blood pressure on both arms. A difference above 15 millimeters of mercury was associated with a 70% increase in peripheral vascular disease and significantly higher cardiovascular mortality. Most people have never checked both arms. Most doctors measure only one. Signal 4. Heart rate recovery after exercise. After 1 minute of rest, your heart rate should drop by at least 12 beats per minute. People with slow recovery had 4 times the mortality risk. 4 times. Walk briskly for 5 minutes. Check your pulse immediately. Sit down. Rest 60 seconds. Check again. Less than 12 beats dropped. The signal is on. 3 blood markers and 1 imaging test. That is the actual checklist that preventive cardiologists run on themselves. Marker 1, HSCRP, high-sensitivity C-reactive protein. It measures systemic inflammation directly. Below 1 milligram per liter, low risk. Between 1 and 3, moderate risk. Above 3, high risk. Ask your doctor for this test by name. Most never order it. Marker 2, LPA, lipoprotein a, the most underdiagnosed cardiovascular risk factor in modern medicine. Genetically determined, does not respond to diet or exercise. 20% of the global population has elevated LPA. 1 in 5 people walking around with a hidden cardiovascular time bomb they were born with. Most have never been tested. Below 75 nanomoles per liter, acceptable. Above 125, significantly elevated risk. You deserve to know your number. Marker 3, ApoB, apolipoprotein B. Standard cholesterol panels measure LDL by weight. ApoB measures the actual number of atherogenic particles in your blood. You can have normal LDL but high ApoB. High ApoB means more particles hitting your arterial walls every second. More damage, more inflammation, more risk. Below 90 milligrams per deciliter, optimal. The imaging test. Coronary artery calcium score, CAC, a low-dose CT scan, 10 minutes, score of 0, very low short-term risk, score above 400, aggressive intervention needed. A 0 CAC score is one of the most reassuring findings in preventive cardiology. A non-zero score is not a death sentence. It is information, and information is the only thing standing between you and a Tuesday morning that changes everything. Up to 80% of cardiovascular events are preventable. 8 out of 10 heart attacks do not have to happen. Not with surgery, not with expensive drugs, with information, with early detection, with the right questions asked at the right time. The people who die from sudden heart attacks are not unlucky. They are uninformed, and uninformed is something you can fix. Here is what you do this week. First, look in the mirror. Check your iris for arcus senilis. Check both arms for blood pressure difference. Second, do the heart rate recovery test. 5 minutes of brisk walking, 60 seconds of rest. Count the drop. Third, at your next appointment, ask specifically for HSCRP, LPA, and ApoB. If your doctor says you do not need them, find a doctor who understands preventive cardiology. Your heart has been running without complaint for decades. The least you can do is give it the right diagnostic tools to work with. Hit subscribe for your next dose of Logic Serum because your body has been keeping secrets from you for years. We are just getting started.